This is Dr. James, and today we're going to talk about leg pains in children. And there's multiple different things that can encompass this. So let's go through the severe and then the less severe. So the things that you worry about, the scariest thing with leg pains, are going to be things like rheumatoid arthritis, an infected joint, or an osteosarcoma. So how do you tell the difference between these bad things and then the things that we'll talk about that are more benign? So the bad things are always going to have things that you can see or touch. So with a rheumatoid arthritis, you should see swelling, you should see warmth, you should see redness. None of these things should you ever see if you have some of the benign things. The other thing is an infected joint. An infected joint, a septic joint, is very severe. They're very sick. It's very rapidly progressing. These are going to be kids that have a fever. That joint is going to be red. It's going to be swollen. It's going to be extremely painful. And it's going to be rapidly progressing. And this is an emergency and you need to be seen right away. Osteosarcomas, a little harder. You may not see anything right away, but it's going to be solitary. They're going to point in one spot. That pain is always going to be in the same spot, and they're going to point to it every time. It doesn't move around. And so when you have that, then you're concerned and we need to rule that out. Now let's talk about more of the benign things. Well, one of the common things that kids get, will get Charlie horses or leg cramps. These are going to happen if they're overly fatigued, if they get dehydrated. You see this a lot in our sports kids just because lots of exercise, lots of work, lots of depletion of glucose and minerals, getting dehydrated. And so in these kids, you just want to make sure that you massage them. It'll feel a little bit better when you massage it. Of course, they're in extreme pain while it's happening. Make sure that they're hydrating. The final category that we kind of lump these into is what we call growing pains. Now, growing pains could be categorized as, growing or healing pains. Kids are just rough, and so they're constantly running around, bumping into things, hurting themselves. And then at night, these things heal, and sometimes healing causes pain. If you don't believe me, go break an arm, and you'll notice that like a week or two into it, it causes this deep bone pain. That's because it's healing. Well, that can cause pain. Then, as they're growing, bones grow faster than ligaments and tendons, and so that stretch can cause pain. And this is usually going to happen closer to the joints. These kids are going to have this a lot of times happen at night. They're going to want you to rub it or massage it. It can happen a lot of times when it happens, especially with growth. They grow in spurts, so they're going to be complaining about this every day for a bit. But again, you shouldn't see anything. And so what I tell my parents with growing pains is to reassure myself, I want to have seen it happen in multiple different places, either multiple different places in the one leg or in both legs. The moment that you get it in both legs, that's very reassuring. And I never want to see anything. I don't want to see any redness. I don't want to see any swelling, and I don't want to feel any warmth. If you have those, or if you have the pain always happening in the same spot, you need to talk to your doctor and rule out the bad things. Otherwise, with just the growing pains, some ibuprofen, Tylenol's not going to really help with this. You need something that's an anti-inflammatory. But some ibuprofen, make sure they're drinking plenty of fluids, getting some extra rest, and rubbing on those sore spots will go a long way in helping them.